Many of the parents are aware of need for resuscitation, Apgar score and everything. So one thing that we as a medical fraternity should tell the parents is the situation dependent risk to the baby. So majority of the babies who need resuscitation are just a little bit stunned due to the labor process, because during the labor the uterus is contracting, there is less blood flow to the baby, there may be a slight reduction in oxygen, and if you look at the sequence of events that happens when the fetus is deprived of oxygen and blood flow, the baby first stops breathing briefly, that's called primary apnea, and then as a reflex response the brain starts gasping response, so the baby has a period of fast breathing, gasping starts, and then the secondary apnea, which is a more prolonged, more difficult stage, happens. So if the baby goes into secondary apnea, you have a pale baby who is very floppy because the blood flow to the brain is reduced. So this is a more serious situation. Suppose the baby comes blue, but on rubbing the baby or starting deep breaths, the baby starts crying. That's a good sign. The baby is not insignificant asphyxial injury and is responding quickly. But a baby who is pale, who is floppy, who needs significant prolonged resuscitation. So we have some tools to measure the response. The Apgar score, for example, we have the cord gases. Remember that these are only markers. These are not absolute. We also look at the progression during the labor, the fetal distress parameters, how long the baby had a low heart rate in the delivery area, whether the cord gas was significantly acidotic, which indicates that the baby had reduced oxygen and blood flow. So all these affect the impact. If it's a premature baby who needs resuscitation, but the baby has come out in a good condition, there is no immediate risk to the brain, apart from what is the risk from being born premature. But in a baby who is born through fetal distress, where you have acidosis, this is called birth asphyxia, and this leads to a risk of what we call hypoxic ischemic encephalopathy, or HIE. HIE is nothing but reduced flow to the brain, the hypotension, the low oxygen, which causes ischemic injury to certain portions of the brain. How far the brain is affected, which areas are affected, depends on how severe the problem is. And obviously, the prognosis can be affected by this. So the baby's future outcome can be affected. If the baby has significant neurologic manifestations like seizure or coma, we do have options now to do therapeutic hypothermia in a neurologically abnormal baby coming through the setting to reduce the risk to the brain. But obviously, there is a risk to the brain despite all this. The proper resuscitation, good care of the baby, therapeutic hypothermia where it is indicated, maintaining the blood sugar, maintaining the temperature of the baby, everything is important after the delivery. Prompt resuscitation is key as well, but how the baby responds after birth, whether the baby has seizures, whether the baby has floppiness, whether the baby tolerates the suck feeds, all this will guide us. The baby who has symptoms of neurologic problems, we do the MRI scan of the brain, which can give us a guide as well. So these are things which can help you to prognosticate. If the baby had seizures, if the baby is neurologically abnormal, definitely the risk is higher. And any baby where we categorize as a high risk, we start early intervention treatment, where there is physiotherapy, occupational therapy, neurodevelopmental pediatrician, or a neurologist monitoring the baby. So these will help us to support the baby's development, because the brain can develop outside the womb in a normal way if we stimulate. So even a baby who has a brain injury doesn't necessarily mean the baby will be handicapped for life. There are things which we can do to improve the outcome and reduce the sequel. So that's why early intervention, being in a setup where you can stimulate the baby in an appropriate way, may reduce the impact. But despite all this, there are babies who get problems like cerebral palsy, hearing loss, vision loss, mental retardation or learning difficulty, as we call it. So all these might happen. That's a small number of babies. Suppose we have severe hypoxic ischemic encephalopathy, which is grade 2 to 3. In grade 2, about 40% of the babies will have sequelae, while in the grade 3, which is comatose babies, were very severe. Quite a high number, 70% or so may have brain damage or even more. There's a high risk of losing these babies as well. So to put it in short, obviously, most of the babies who need resuscitation develop normally. So they may have very mild HIE, which is stage 1, or they may not have any HIE. And in a premature baby who needs resuscitation, it's not going to impact the development directly. But prematurity itself has impacts on the brain, which we'll discuss later as well. So in this case, I mean, if the baby had birth asphyxia, had significant HIE, then the risk is more. And in these babies, you need to channel your efforts to optimize the brain development.
Great.